be attentive. Know your pet, know they're normal, and know when things are not normal. Your pet will benefit from it because you'll immediately know when something's up. The second thing I would say is don't be lazy to read. Read studies, read package inserts, read journals, read because, well, number one, your horizons broaden. You become more intellectual. You can start making smarter decisions. You can maybe identify things that you're doing wrong or things that can be improved. And the third thing is just do your best. Buy the best food you can do. Give your pet the best life you can give them. Because at the end of the day, we always joke about it, but your pet didn't choose you. You chose your pet. And if things go wrong, your pet didn't have a say in that. And life happens.
Every vet has those questions they get asked over and over again. Sometimes they're serious, sometimes they're funny, and sometimes they're a little bit of both. Today, I'm joined by Dr. Nico du Preez. You may know him from Zoomies on Instagram, where he brings humour and heart into veterinary medicine. We are tackling the most common questions pet owners ask, plus the things that vets talk about the most in the consult room, but owners wish they really understood. If you enjoyed this episode, please don't forget to subscribe to the Paws Effect Podcast, share it with your fellow pet lovers, and leave us a review. It really helps us keep bringing you these conversations. I'm your host, Dr. Cara. Let's get started. Dr. Nick, before we dive into the big pet owner questions, can you tell us a little bit about Zoomies and how that started?
Yeah, so when I started my online platform, I kind of had this idea of, okay, you got to stand out somehow, right? But I need a catchy name, something that people are kind of already familiar with, that people associate with animals. And then the first thing that kind of came to mind was like, well, pets get Zoomies, right? Everyone knows the term Zoomies. My dog has Zoomies, my cat has Zoomies. The only problem I think I made there is now people don't necessarily think I'm a vet. Maybe they think rather I'm like a animal advocate or something, right? But I'm loving the whole idea of trying to reach out to people, making them laugh, doing educational stuff. The big thing what I'm trying to do on my side is I'm trying to be a good representative for veterinarians as well. Not just Western vets, but also, Eastern medicine practicing vets, holistic vets around the globe, trying to incorporate as much information as I feel is true and beneficial to clients. But the one remedy I think across all medicines we can agree on is laughter. And that's something I try to get over to my audience.
Absolutely. I mean, humor seems to be a big part in how you connect with pet owners. But why does it work so well, particularly in vet med?
So a small little story, what I learned is that when I became a vet, I had this idea that I'm going to be working with animals. What I quickly realized is that you work with humans and then get to work with animals. Okay. But then actually I realized, but I like this. I like engaging with the people, hearing these stories. Where does the dog come from? What bond do you and your cat have? What's the story behind everything? So I kind of took that approach and the thing of I will communicate through the client what is good and bad for pets. That was my kind of philosophy.
Absolutely. I love that. I mean, it's so true. I think we're having to understand that owners have a different expectation from us. They want to build trust. They want to connect with us. And that's why I think the humor aspect of being able to talk about some of these difficult situations, but also just to give an insight into some of the things that we're dealing with is so beneficial and so lighthearted. So, I mean, I'm personally enjoying it because it's so relatable for us as professionals, but also as a pet owner, it's great stuff. So if you could pick one question that you've been asked by most pet owners, and the one that you could answer in your sleep, for example, what would it be?
That's actually a tough question. Because I mean, I'm sure you can relate. You get asked a lot of questions, like a lot. Like I think 80% of the consultation is just asking and answering questions. The one I would say that owners can relate to the most, if I had to kind of create a question that covers quite a broad spectrum of questions, is that I think people just want to know, what should I be doing? Right. And you can apply that to any pet. Doctor, what should I be doing? Even if you know what you're doing, what can I change, And my rough answer to that is absorb as much information as you can. Get as much literacy, journal articles, extracts, read books, get opinions, look at posts, talk to people outside of the veterinary profession, breeders, nutritionists, all those things. Absorb as much information as you can. And with that information, you apply that to your lifestyle and relationship with your animals, and you make the best decision that you think for your pets. That's kind of what I tell people. Do your best. Do your best that you can do.
Absolutely. But my concern, obviously, with that, and just a counter to that, and I'd love us to just tackle this a little bit further, is that there is a lot of misinformation out there.
Yeah.
There's a lot that, and I don't want to discredit breeders or Dr. Google, and we'll go there, I'm sure. But I worry about the fact that there is a lot of information out there, and there's a lot of misinformation, and owners are faced with, it's like me in the Woolies aisle going, ooh, I'm hungry. Like, what am I going to have? I cannot make a decision. You are faced with all this information thrown at you, and then owners sometimes listen to the voice that shouts the loudest, or the trusted source, and that veterinarians are not necessarily the trusted source anymore. Are you noticing that? Is that something you're trying to tackle through your online platform?
So big. So I think you'd relate. The most common thing we hear as vets is vets are sellouts. Vets have been bought over. We've been brainwashed. Propaganda, whatever term people are using. Firstly, just summarize. That's nonsense. Nonsense. Okay. Maybe one vet somewhere, maybe vast exclusions. The majority of vets are not out there trying to, pick your wallet. We really aren't. Maybe one. Maybe you've had a bad experience, and for that, I'm sorry. It shouldn't be like that. Find a different vet. But I think one big factor, and I'm sure we'll touch on it later as well, ChatGPT. Okay. ChatGPT can be an amazing tool, such a powerful tool. It can be a vet in of itself if you pose the right questions and give it the right kind of context. The big thing that you pointed out that I would tell people to look at is the following. It's very easy to fact check someone. Just because you saw, like you said, an obnoxiously loud, familiar face on TikTok or on Instagram, and they quickly pull up a study and then it kind of goes away. I can also do that. I can make any claim I want. I can actually go outside and pick any grass or tree extract. I can put it in a capsule and I can put it in a bottle, and I can put any single claim that I want on that bottle. I can say whatever I want. And only when a dog or a cat gets hurt will the FDA or the SABC step in. But until that point, I can do what I want. I can say this, your vets are selling you out. This is what you need. And that's dangerous. And that's where the client needs to fact check. It's so easy when someone makes a claim. Fact check. And ask ChatGPT, hey, ChatGPT, I read this post where this guy was saying this. Is this true? Please provide scientific support or journals or extracts to support the claim. Easy, because you have to sift through nonsense. And it's, like you said it perfectly, it's everywhere. It's everywhere. Vets don't have as much time as content creators on average. We don't have as much time to make so much content, but they've got a lot of time, it seems.
Absolutely. And I think, it's so important, that trust relationship, that it can be frustrating for us as veterinarians who have good intentions of providing credible information for pet owners, me in terms of the podcast, you in terms of your social media platform, that there is a frustration. Do you think that we are being discredited by other professionals? Do you think it's good that people are on there and that we are providing information, and now actually we should just be more vocal about some of the stuff? Or do you think it's a case of, like, historically you just ignore the noise? How important is it for us to challenge the misinformation out there?
I think the first thing, if I have to kind of look through the lens of the average pet owner, I understand the frustration. I really understand the frustration. Maybe it's too easy for me to say, absorb so much information because there's just too much out there. there is simply too much with the internet. The big thing, I think, is still when you are frustrated with whatever issue, and I get it with pets, the answer is never simple. That's the big thing. And a lot of content online may very well oversimplify a big problem or very big issue. If I use an example, how common are itchy skins in dogs? Extremely common, right? For me to say, if I was not a vet, anyone, to say you need to give your dog an omega-3 supplement and it will do better, that is way too simple of a statement to be accurate, because you're inferring that every single dog with an itchy skin has an omega-3 insufficiency and that every single owner in the world with an itchy dog is not giving enough omega-3. That's where vets come in. And this is what people, I think, need to really do introspection on. You build a relationship with your vet. If you don't like your vet, get another vet. But you need to build a relationship with your vet because your vet has context. They know your budget. They know your history. They know your dog's history, your cat's history, your horse's history. They know which environmental factors we need to consider. They know which nutritional factors we need to consider. That's how multi-layered a simple decision can become. And that's something that social media cannot provide you, or ChatGPT cannot provide you. What I encourage my clients to do is, and I think Dr. Mike, he's a big online face in the human medicine world, he says it beautifully. I encourage you to be inquisitive. I encourage you to ask questions. I want you to come into the consult and ask me everything that frustrates you. Yeah, we only have a 30-minute slot, let's say, but we can use that time. And I encourage you to be skeptical. It will very quickly unfold if I don't know what I'm talking about, right? And that's something I've had to challenge a few content creators on in the past, where, we do maybe a live together or something, and very simple questions kind of gets them into a corner. And by no means was it the idea to get them into a corner. I just kind of asked basic questions and then the truth reveals itself. So that's something I think the listeners should really think of, like, get a vet that you are in line with, that sees your picture, your individual picture, and make a decision with your vet. Every time, you need to make something like that. But stay inquisitive and intrigued.
You look at me, I look at you, I see the love in your eyes. I'm lost in
Health you can see, love you can feel. UltraPet, the science of love.
You talk quite a bit about food. Let's start with one of the top questions I'm sure you asked, considering you discuss diets quite a lot on your social media page. What should I actually feed my dog or cat? How do I make the decision between brands?
My short answer to that is, if I knew, I'd probably be a rich man. I think it comes back to what I said earlier. Do the best you can. If I give you a client the most expensive dog food, cat food in the world, and they don't eat it, is it really the best food now? You see, if they get diarrhea from it, if they vomit from it, is it really still the best food? The idea, what I'm trying to do on my social media is to, yes, I probably do to an extent, and maybe I should be better, give my opinion when evaluating the food. But my thing that I've realized is that, and I don't mean this as an offense to anyone, but the average person doesn't know what it says on their cat or dog food bag, meaning that they haven't actually looked at what they're feeding their cat or dog, right? If you flip the bag around, there's so much information on there, like a lot. And you don't really even need to know really what you're looking at. Like, most of the foods are pretty bare bones. So my idea more is to kind of tell people, right, I will tell you with a slightly trained eye. I'm by no means a nutritionist, but I guess I know something. This is what the bag says. These are the claims they're making. This is what they're putting into the food. And this is the price that you're paying for all of these things. And then my idea, I guess, is to tell them, do you think this is worth it? And then that's maybe where my opinion comes in and say, I don't think so. By no means am I bashing that food. Maybe sometimes there's just a better alternative.
Absolutely. Now, going off the commercial pet foods or the fad diets, some owners are really keen on feeding human foods. What are some of the human foods that people need to be aware of that they just should not be feeding? And what is your feeling on just entertaining this whole subject of including human foods in your pet's diet?
I think if I mention one thing now, you're gonna start laughing. But I think the idea of adding whole foods and fresh foods into your dog's diet that fits their lifestyle and their own uniqueness is amazing. If you have the time, the budget, and the money to make a complete, whole, balanced dog or cat food, all power to you. That's amazing. I think the vast majority of us simply just don't do it. Like hell no. There's no way I have the time. And when I have the time, I just simply don't have the energy to let alone cook for myself, now for my pets, But the inclusion of it, we do a lot. Me and my wife are both vets. We do fresh food inclusions in, I would say, 9 out of 10 meals for our dogs. So not just table scraps. That's like a big no-no. But whole foods like, yogurt, pumpkin, fish, things like that, off-cut meats, things like that. I'm a big advocate for it, and the dogs seem to like it a lot. The big thing is there are certain foods, and people must remember, dogs are not cats, and cats are not dogs, and neither of those are humans. And that's a big thing to remember. Like, I can eat a whole bowl of grapes, no problem. My dog can, I don't even know how much they can have for it to be toxic, but it's just not worth to even look or try. And I think a big thing we're seeing, isn't it, these days, is garlic. I don't know how you feel about garlic. My ultimate conclusion is the following. I'm happy to read I'm happy for people to send it to me, a peer-reviewed study showing that there's any benefit to giving garlic in cats or dogs that I can't get from a safer alternative. I'm happy to read it. I've read through probably close on 20 garlic studies, and there were, I think 3 of them weren't in humans. The rest are all human stuff. And even there, the literature simply says you can just get it from somewhere else. So
absolutely.
Yeah, I don't know how you feel about
the risk.
That.
Yeah,
it's not worth the risk.
I'm in agreement. I think you got
even topically,
you got to weigh up the benefit. Agree.
Like
so
benefits, risks.
Totally agree. So let's get back to the Zoomies. I know it's just funny, or like, does it actually mean something? Is there a reason why our pets get Zoomies? Yeah.
So one thing I've worked on myself is to be less critical, and by that I mean to the average viewer or engager. I want my platform to be a place of happiness, a place of laughs, a place where people can like look at my content and be like, yes, that's so me. Yeah, I've been there before, and I do get that quite a lot, and that's my idea. I want people to see you and I, Dr. Cara and me. We're also just human. We're all just humans navigating through this world, trying to do our best, and might as well do it with a smile. And then, hey, look, we've got these 4-legged companions that just make everything so much better. That brings so much joy. And it's a universal language. Isn't a happy dog having the Zoomies or a playful cat like a universal language in of itself? And it's always bliss, always.
So why do they get it? What does it mean that if pets get the Zoomies?
I think it's just like a burst of joy. My rationale is, dogs have been domesticated, roughly 30,000-40,000 years. Surely some basic emotion had to rub off on them And wouldn't that be amazing if one of those emotions was joy? That these animals have spent so much time with humans that joy was the emotion that manifested, and they can't talk, they can't go out partying, but they can have Zoomies. They can like show you like, oh my gosh, what do I do? And I just go like that's how I hope it gets explained.
I love it. I love it. So before we leave the whole what pets can eat and what they can't, when you have clients that come in and say, why does my dog eat grass? Is there something wrong or is this normal? What is your advice for those clients?
Yeah, it can be normal. The Jack Russell that we saw earlier that I have is a grazer. He will go outside just to have some grass. Like, I don't know if it's my fault if I'm not feeding him enough, but he will just go and have some grass. All power to him. I think generally maybe it's an indicator of like, nausea, upset tummy, stomach pain. Could it be maybe like an indicator of a degree of malnutrition? Maybe. I haven't diagnosed that specific yet. But I think it rather comes down to, in my opinion, if your dog's eating grass, it's probably behavioral, meaning they're choosing to do it for no particular reason, or they're nauseous or have some degree of belly, abdominal issue. I don't know how you feel about it.
Agree. No, I totally agree. I think, often they use it to purge or whatever, but I also know my dogs occasionally like to eat grass and nothing comes up. It's just a little, like you say, I think they've forgotten that they're dogs.
Yeah.
They're cows for the day. So one of the other top questions I feel is, do indoor cats really need vaccines and parasite prevention?
That's a loaded question, isn't it?
I thought you were up for it.
Yeah, I think it requires some degree of nuance, because I've got a two-phase answer to that question. Emphasis on the need. Do they need it? No. I guess the answer would be no. Maybe there's, if we're only taking into perspective the cat, probably not. Probably not. Could they benefit from getting it? Yes, definitely. Could we avoid major issues? Yes, very likely. Could it prevent them from dying a horrible death? Yeah, it could. It could. Are there laws in your country that tell you that pets or animals need or must have certain vaccines? Likely, like in South Africa, you must get the rabies vaccine. So what I normally would tell a client getting asked this question is, I would say, well, maybe why not? Why don't you think they should be getting the vaccine? And then I think from there you can kind of start seeing where the pet owner's confusion or doubts lie. And a lot of times it's not really with the vaccine. It feeds back to our previous conversation of something they heard online, someone said something, or something just doesn't make sense to them. My ultimate answer would be yes. Because this is what, to give an example, this is what a lady said to me the other day. She put the cat on the table in front of me, sick, very sick. And I asked her, is the cat's vaccines up to date? And she said, no, I don't vaccinate my cats. And I said, can I ask why not? And she said, well, they never leave the house. But the cat is in front of me in the vet consult. So they do leave the house. The vet consult is not a sterile environment. The cat's here now, might as well vaccinate it now. So can they get out? Do you bring things in to the house? You see, so the risk with vaccines is that small. Why not just give it? Just give it.
Agree. Totally agree. So another question, top question from pet owners. How do I know if my pet is actually in pain or is just slowing down with age?
Oh, I love this question. I actually want to do a whole YouTube video on this topic, right? Again, cats are not small dogs, right? And horses are not big dogs, and guinea pigs are not little cats. So it will vary from species to species, and even within species there'll be variance. If I have two dogs, I've got two dogs. They show pain very differently, very differently. A big thing for me, I don't know about you, but a big thing for me is change in routine, right? Not eating as much, drinking more water, not moving as much, more vocal, less vocal, more attention seeking, less attention seeking, moaning, aggression. Those are general indicators for me that at least there's pain somewhere. And I like to differentiate between pain and discomfort. If I have stomach cramps, I wouldn't regard them as painful, but I would definitely say it's uncomfortable. But if I break my arm, that's painful. Arthritis in the early stages, is it painful? Maybe. I guess maybe, yes. Maybe very uncomfortable at least. Is arthritis painful at end stages? Yes, very, very painful. So I tell people, you know your pet better than anyone. No one knows your pet as good as you do. I hope. Sometimes your intuition, if you think something is not right, you're generally right. Something isn't right. And generally it's pain. Generally it's pain.
That's a great explanation. I love it. So on to the next one. If there's one thing that you find yourself saying 20 times a day to owners, what is it? What is the thing that you feel that just repeats and repeats and repeats through every consult?
I'm going to forget. And that's like, I'm going to forget. I'm a man. I'm going to forget. No, the easiest thing is you can pay the ladies in front. No, I'm kidding. I'm just kidding. I would say, really, the best thing, I actively try to say what I'm about to say. And I hope some of my clients that are going to be watching this will agree. I try to tell people when they're doing a good job. Like I'll tell someone, good job. Like, wow, I'm proud of you. Or, wow, did you see that? Wow, that's really good. So something I think I say over and over throughout the day is maybe trying to acknowledge to pet parents, you're doing a good job. It's because you'd agree, I guess I can ask you, isn't it hard to tell, sometimes it's not even possible, to tell a client when they've made a mistake or maybe when they haven't been doing a good job? Like, that sucks. And sometimes you don't really have the guts to say it. You kind of kind of suggest that they maybe didn't do the best thing.
So you like praise. Is that also from your parenting role? Because you're a father, aren't you? So you're practicing some of the same stuff. I have to very actively do the well done and I'm proud. Yeah. And it's like it's a very something I have to make a real conscious effort to do. Obviously less so in consult, but more at home to say, but because it's very easy, like you say, to say you've done this wrong. But it can make such a huge impact by saying you've got this right. So I love that. Great answer.
And I think most people aren't trying to do wrong onto their pets. They really actually are trying, at least to a small degree, to give their pet a good life. And I think it's nice when someone acknowledges that. If someone says, hey, you know what? Good job. You're trying. I like that. That's very reassuring. Maybe that pushes them to be even better. I hope.
Love it. So let's talk about weight. Weight is such a sensitive topic with owners. Why is it so important for vets to bring it up? And how do you tackle this conversation?
I've got a lot of sympathy for doctors that need to tell their human clients or patients that there's a weight issue. I think the important thing is, and the thing that I lean on the most to make it as easy as possible for me is I kind of tell the client, I know you love your pet. I know you love little Fifi. I know you love, Pussycat. I know you do. But just like you, I also want them to live as long as possible. And, the science kind of shows an obese animal doesn't, on average, live as long as a well-conditioned animal. But I think it's probably the hardest conversation to have in our industry. I don't think
do you
I
ever
can give
lean
good
on humor?
advice.
Do you ever make a joke? Okay.
All the time. I think that's the only effective way. Like if the client opens it and says, "Oh, I know little Fifi's a little fat," then I'll be like, "Oh, Shane, she's a little chunky, isn't she?" You're kind of like, yeah. But even then, like, I don't even think I can give good advice from that conversation. It's tough. It's tough.
Do you groan as you lift them onto the table?
Yeah, I'll be like, "Oh, yeah, did you hear my knee click?"
Ooh.
Yeah. or just kind of slap them on the side, one of those little slaps, and be like,
pat. Well covered.
Yeah, well covered.
So let's talk. Obviously, we've spoken about the fact that a good body weight can really help with longevity. Let's talk about prevention in terms of fleas, ticks, worms, dental care. Why are vets so obsessed with these topics?
There's a big conspiracy, I guess, in the world, where there's this whole thing, a movement against medicine, right? If I can bring up one point that I think leads into answering the question, we as vets, I guess I can only talk for vets, or at least vets in my immediate circle. Again, we really want your pet to be healthy. We would actually prefer your pet to be on 0 medications. We really would. That would be amazing. That would make us happy. Would you then say we won't have a job? No, pets will always get sick. We know that as well. There will always be disease. There will always be illnesses. There will always be diseases. But we would want your pet to be on as little medications as possible. So prevention is going to be our easiest way to accomplish that. There's a big thing, if I could be as bold as to say, claims that are made by people that focus on Western medicines or science-based medicines, and people that focus on natural or holistic medications. Now, I feel there's room in the medicine field for every type of practicing medicine, and they all play a role. The only criticism I have is there seems to be a tendency of, if I, as a science-based vet, tell you, this medication is what your cat or dog or horse or guinea pig needs, there's a big thing or kickback that you get back from people saying, "Oh, it is the drugs that are killing your pet. It is big pharma that wants your pet sick. It is, vaccines that is killing so many dogs and causing so much cancer." But that same attitude isn't projected onto natural or holistic approaches. Meaning, I then tell people it is the lavender oil that's making your cat sick. It is the 23 oil concoction eye drops that's irritating your dog's eye. It is you are killing your dog by not vaccinating them. You see that same mentality isn't applied both ways. And again, it comes to the thing of it's never that simple. It isn't because I'm vaccinating my dog that they're getting cancer. You are disregarding all the other possible causes for it as well. But I think the big thing that I'm kind of leading into is that vets want your animals healthy. We really want your animals to be healthy. We want to prevent them from getting sick in the first place. So that's why we put so much emphasis on nutrition, vaccinations, walks, obesity, monitoring pain signs. We want to tackle it before it becomes an issue.
Totally agree. So I suppose, we just discussed this early on in terms of the information out there, but Dr. Google, Your feelings about Dr. Google.
It's like a 50-50.
And how often do you hear that? How often do you hear but Google said?
Daily. Or these days, ChatGPT. I had a discussion with ChatGPT, and it's 50-50. Sometimes people come in and they're like, I Googled and then it's not accurate. Let's put it like that. But other times what helps is if, someone plonks a cat down in front of you, you'll do your investigation and you're about to have a difficult conversation. And then the client opens up and says, oh, you know what? I Googled about, kidney failure in cats and I think this is what he or she has. And then that actually makes it easier to have the conversation. You're like, oh, well, you know what? I agree. I also think I agree with Google. So it's more just knowing where and what to read, but it can be quite frustrating, to be honest.
And in terms of the yearly checkups, what do pet owners miss when they skip them? What is the importance of coming in at least, if you don't want vaccines, that's one thing, but coming in for your routine yearly checkup?
I'm happy to tell people, if you don't want to vaccinate your dog again every year, I'm down for it. We can talk about what suits it, but it does not take away the importance of an annual checkup. That is like, it's not even a discussion. It is, there's maybe it is a good idea for you to bring your pet into the vet once a year. For the big thing of, we have such busy lives. We've got so much going on in our lives with your own health, everything going on in the world, social media, family, friends. It's very easy to miss something. And only when the vet asks the right questions, you can kind of see that light bulb go on. Have you noticed your doggy coughing recently? Or has your dog been coughing for a while? You know what? Now that you say it, yes, she has. And then life happens, man. But that's why annual checkups are so important. Like, we know you will miss some things. Your dog or your cat can't talk to you. They can't say, like, here is where the pain is. They're just not going to say anything, especially cats. Cats will walk in the consult room with a broken leg and purr and be happy with a leg dangling like this. Meaning, so if they have got a little bit of pain somewhere else, you won't even know it. It comes to the prevention. Be there every year so we can prevent a bad thing from going unnoticed and taking a life too soon.
Yeah, so important. I totally agree. And I mean, even like you say, that flag up of, we always do that full clinical examination just to, listen to the heart. And then if they're like, oh, it's coughing, plus I hear something internally that's indicating these kind of things can work synergistically and really help mitigate some of the fallouts, and like you say, we want pets to be healthy. So the clinical examination, the history, that yearly checkup is such a vital opportunity for us to tackle things early.
That's probably where we get, I'm sure you can agree, in the consult, talking to the client, is where we probably get most of our clinical information before any test.
Totally. One myth that you hear all the time that makes you shake your head or at least do that internal eye roll, but also makes you laugh.
A lot of them. I try to laugh about a lot of things because it doesn't help to get upset. Life is too short to get upset about too many things. I would say, I'm laughing because I'm thinking of a few, but I don't think they're good for to publicly announce. Because I think I might step on some toes. I think the funniest one is the older couples, the older pet owners, when those dogs come in with like raging diarrheas, happy, not dying or anything, but diarrheas, and then you say like, have we given Fifi something off the table? And it's normally the men where they come in like, oh, I can't eat some biltong without giving her a taste? How do I eat some Druivort without giving food? And I'm like, wonder where the diarrhea came from.
I love that. I must say, I totally relate, and I'm hopefully not one of the elderly ones yet, but I'm heading in that direction.
Not at all.
As we all are. But I've seen it, and you're saying diarrhea from biltong. I have a new kitten who discovered the bowl of biltong, and she's a Mancoon, and she is obviously very inquisitive. Some cats like, I'm not tasting anything. I'm super fussy. I'll only eat that particular food. This cat is super adventurous, and she's happy to sample anything in a bowl. And I saw her eating, and I chased off because I didn't want to share my biltong. Next day, raging diarrhea. Yeah. So I totally, it's a true story. It happens.
Yep.
The consequences.
The client will never open with that one. I do give biltong. They will just kind of keep it in the back until you start kind of poking, and then they're like, we do give some, the little fat from the choppy, I'm like, okay.
And what would you say is the funniest or strangest question a pet owner has ever asked you?
I've got a story was the funniest question, where a lady came in, but worse than my voice, she had a very raspy voice. And then she asked me, and she was so polite and such a lady. And she came to me like in private without a patient. And she asked me, like, doctor, like, is it normal for cats to, and I'm like looking at her, I'm like, what? She's like get on your arm. I'm like, man, what do you mean? Like, and she's like, no, like on your arm. And then I'm literally staring at her, and she's like, and then it gets wet. And then she was insinuating that the cat is humping her arm. And I was like, ma'am, do you mean your cat's humping your arm? And she was like, yeah. But so that was probably the funniest, because I had to like really keep that laugh like down, because she's serious and it's not funny, and she's being so polite. That was probably the funniest direct question. And I was so crude about it. I'm like, humping, you're like, And then you said the strangest question.
The strangest.
Okay. She asked me straight up, male dog. Do dogs have penises? And I'm like, ma'am, but I'm serious. Like, ma'am, are you serious? He's like, yes. I'm like, how do you think we get puppies? And she's like, well, I've just kind of never thought about it. But I'm like, man, but you've got a male dog. And I'm like, the dog is on the table. I'm like, did you see this? She's like, yeah, but is that a penis? I didn't, in the moment, I was like, what else could it be? Like, I'm not even trying to be funny.
Umbilical.
That was just weird. I'm like, and she was quite old. Hey, like, let's call her, she was like, I don't know. I wouldn't, not saying that it is old, but I mean, experienced in life. Let's call her 60. 60 years, you've never thought about that, or like, yeah. I'm glad I was the one that could answer it for her. Lucky me.
Yeah. So, onto less risky questions. If pets could actually talk back during consults, what do you think they'd say to you?
Help me. I'm kidding. No, I'm kidding. It depends on what type of pet. Feral cat, there'll be a few bleeps. Okay, I think. I think on average, it'll be like a kid. They'll probably tell you things that you kind of shouldn't know on a personal level about their clients. Like, oh yeah, the guy that comes over when dad's not around really gives me some nice treats. Do tell. Like, I think you'd hear quite a bit of gossip, especially if you've got something like a Labrador or something. I'm sure you'll hear like as much of that client as possible.
I love it. So back onto more serious stuff. We digress. If every pet owner listening could take away just 3 things, let's say 3 things, that would make their vet's life easier and their pet's life better, what would it be?
Be attentive. Be attentive to your pet. And that includes it doesn't help if you don't know what your pet's poop looks like. It doesn't help if you don't know what sort of energy levels your pet has on average. You need to know your pet. Know your pet, know they're normal, and know when things are not normal. Your pet will benefit from it because you'll immediately know when something's up, and your vet's life will be easier because we ask these questions not to point fingers, but to gather information. And it's frustrating when a client comes in and you ask surface level questions and they don't seem to have the answer. So one, I would say, be attentive. I've got a third tip, but I'll leave it for last. The second thing I would say is, I think I actually said it earlier, read. Don't be lazy to read. Read studies, read package inserts, read journals, read, because, well, number one, your horizons broaden. You become more intellectual. You can start making smarter decisions. You can maybe identify things that you're doing wrong or things that can be improved. And you and your pet will benefit from that. And well, your vet's life will be better because they'll see less sick animals, we hope, And the third thing is, this is what my whole page is about. Just do your best. Do the best you can. Do the best you can do. Buy the best food you can do. Give your pet the best life you can give them. Just do your best. If you can't do your best, if life hits you, if things happen and you can't do your best, make a plan remember, because at the end of the day we always joke about it, but your pet didn't choose you. You chose your pet. And if things go wrong, your pet didn't have a say in that. And life happens. Pet insurance, people, pet insurance makes your life easier, comes in clutch, and your pet will get sick. As sure as death and taxes, I 100% guarantee you your pet will get sick. Will get sick sometime. So do your best. Just do your best.
Great advice. So let's go to your Zoomies page. You've built a great following and you're making VetMed fun and approachable. Okay. What is your hope for the future of how vets and owners connect?
Yeah, very philosophical answer I have for that. I want there to be open and honest discussions. There's way too many conspiracies and false claims and people thinking that people and companies have bad intentions and ill intent. And I think it's coming from a lack of knowledge. It's coming from a lack of communication. Yes, propaganda, people spewing lies, people pushing products to make money. Those things don't help. Man, we all love animals. I really hope we all love animals. We really just all want the same thing. We all want happy, healthy pets, and we all are waiting for that wonder pill that makes your dog and cat live forever. We're all waiting for it. I would hope we can get to a point where we can have these open, honest discussions. No one takes offense. People say what they want to say. They get the answers that they not want to hear, but need to hear. And everyone reaps the benefit from such conversation. That's my hope and my prayer for the future of veterinary science. And maybe AI will be a good mediator for those things because it's impartial. I'm hopeful. But my whole page around it is, well, we can do all of that and still have a smile on our face. Because we're all just human, man. We're all just human.
So where can listeners follow along with you and your work? Where can they find you?
So I do have some proof of life with this thing. I really need to be better with my social media. But they can follow me on YouTube on Zoomies, Zoomies Official, Instagram and TikTok, Zoomies, or Zoomies Official Dr. Nick. I really need to be better at posting more educational stuff as well. But when I get a splash of inspiration, then it's normally funny stuff. So if you're bored and you want to laugh a bit, I'm hoping my content is helping with that.
No, it's phenomenal. I urge all the listeners to follow Dr. Nick, at least for some light entertainment, if not some information. Yeah, no, it's brilliant. So thank you. And thank you for taking time out of your very busy schedule, particularly when you haven't been well. It's been a really fun conversation, and I know that my listeners are going to absolutely love it. So thank you very much for your time. It certainly kept me smiling the whole time, and I would urge everyone to follow you.
Thank you so much.
Thank you, Dr.
Thanks so much for the time and for the platform. And we need to make the collaboration close.
Definitely. Sounds great. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.